what you're going to do to make sure that you can confirm that, you're going to go to cms.portal.gov, or excuse me, portal.cms.gov. It's going to bring you to this main screen here. You're going to want to click on Login to the CMS portal. You will have to accept this, and then you can enter in the username and password that you think it is. And if you have it correct, well, you will get right in. You will have to change this password every 60 days, and you cannot use the same password that you have used the last 6 tries. Okay? So good luck with that. Um, good luck remembering it as well. So, you can utilize something like LastPass. You can utilize other things. But really, the best thing for you to utilize is a piece of paper and a pen. Write it down and make sure that you have it somewhere. Once you get in here, you're also going to need to make sure that you've requested access, that you have access as a user. To verify that access, you can come over here to your roles. Making sure that you have your roles set up. And then if you view and manage my access on the left-hand side, you will see if you have your information listed in here. If your information is not listed in here, you are not set up, and you will not be able to use the direct link. That is the key. If this is not working, when you get into Blue Cross Blue Shield of Florida and you are trying to sell utilizing the direct platform that we have through Blue Cross, it will not work. Also, be warned that any of you that have not sold marketplace plans last year may also experience a problem. We have confirmed with CMS as well as Florida Blue that there are going to be sporadic issues, which I'm absolutely shocked about, aren't you? That the communication between the CMS.gov portal and Blue Cross and the ability for you to utilize the direct link, well, it might not work. So if it doesn't work, what are you going to do? Well, you have a couple of choices. But typically, the way that you're going to do it is you're going to do it just like you did in SCP, and you will complete that enrollment in that capacity. Okay? So we will have some other solutions for you that it's not working with, and we will share that with you guys on a one-by-one basis. So anyone who is not able to access the access the direct link, you'll have to reach out to Mr. Falco, and then we could come up with another enrollment mechanism for you and see what we can do. Okay? The second thing that you're going to want to make sure is that we have gotten a large response from agents that when you get into Blue Cross Blue Shield, there are a couple of issues. And those issues are surrounding certifications. Those certification issues that we are identifying are going to be for both Medicare as well as those individuals that did not upload the appropriate certificates. So if you have not checked this, then I would advise doing so today. Take you about 30 seconds to check it. Log into your Blue Cross screen, go to your sales and training support materials, and check your certification upload for the marketplace, as well as confirm that everything is done for your Medicare certification. Those individuals that are selling Medicare, even if you certified, you may see a little note that says agent certification error. Don't be alarmed. Just communicate that to your manager or Mr. Falco, so that way we can send it up to leadership, and that way we can get that addressed. But those certificates do need to be uploaded. Remember, it is course curriculum certificates. It is not the certificate of passing the test. Okay? Question coming in. I have an independent agent here in town who says he has access to Florida Blue, but he's still selling Humana and etc. How? Well, he's not supposed to be. So whoever he works with, if Jeff, you want to speak with Mr. Falco and get that name over to Giggy, we could find out who it is, where they are, and who they're aligned with, because that is illegal. It is against the rules, and he will lose his Florida Blue appointment. If you guys also, you understand, those of you that are group producers on this call, he may be selling Florida Blue group, because you do and can sell and broker group insurance products. So those individuals that are here, large group producers on the call today, you're well aware of this. That we have an NCA contract which allows you to sell the the group products with Florida Blue, but it is a contract violation to sell that alongside with Humana. Jeff, just let us know the name so that way we can move forward on that. So, not trying to hurt anybody's feelings, not trying to change anybody's livelihood, but the rules are the rules, and there is zero tolerance from A and B, even internally. If we had an agent that would maybe a field agent direct with A and B, I will be the first person to terminate that agent, and I will not ask one single question. And Giggy the same. So it's not tolerated, and it is not acceptable in any way, shape, or form. Okay. When will the button on the proposal be available to apply now? I'm not sure what button you're talking about. It won't be available to do marketplace applications, shockingly enough, until the 15th. So you will not have any of that access until the 15th. Kind of along the same lines of that question that we have there, I want to remind and make sure that everybody is, accessing and viewing all of the bulletins that you have for healthcare reform, for group, individual, as well as all bulletins. This is a lifeline. We missed our call last week, and I was very upset about that, and I'm being serious, really. And what you need to understand is that there are a lot of communications, a lot of the information that we go over is available through the bulletins or the agent service bulletins. Now, the problem with the agent service bulletins is, well, quite honestly, making sense of them. So you do need to make sure that you understand that these are all in here and that you can take a look at them and you can understand what's going on with them. So when you look at these, you can see, like, for example, we've got step-by-step guides for members setting up ACA payments. This was something I wanted to talk with everyone about last week. As we move to the Affordable Care Act now, that is our conversation. At this point, you guys should be off and running with Medicare. Shouldn't have a lot of questions or hurdles or issues that you're dealing with outside of, just some basic process issue from Florida Blue. But now as we're looking at what we're talking about with the Affordable Care Act, you really need to make sure that you're taking a look at this, okay, and you're understanding that. So the first thing I want to talk about is an agent service bulletin that came out. It was talking about minimum essential coverage to the IRS. Those of you that read that announcement, if you are a normal person reading it, you would have read it and found that you think that your individual clients are going to get a fine for not providing their social or basic information. Well, that's not accurate. That is really aligned towards group-style plans. The IRS came out and said that they need proper documentation in the form of Social Security numbers for all government plans. Those are going to be like the federal group programs, small group programs, and large group. Now, the individuals, we are doing a reach out to them to make sure that we do have all of the appropriate information, such as Social Securities. Now, in the beginning of AEP last year for the Affordable Care Act, or open enrollment first time, we were not able to utilize the Social Security numbers, but now, as you all know, you will be utilizing Social Security numbers on all applications. There were some other things that were important that I wanted to talk about last week as well. Medicare supplement rate changes, those went up 3%. Those new rates are now loaded into IST. When that announcement came out on October the 30th, everyone was surprised because in all the road shows they told us that they were not going to be doing a rate increase, and then they did. Not quite sure why. Telephone Consumer Protection Act, TCPA laws. Don't mess around with them. Using auto dialers, using predictive dialers, and things of that nature are a recipe for disaster. Those individuals that are on this call that are working with larger groups that have dialers or something like that, you may want to reach out to Ms. DeFalco and talk to her a little bit about that because it's a big fat no-no. You have to be using standard dialing systems. You can't be using any Press 1 campaigns. You have to be really, really careful when it comes to TCPA laws. We sat through a couple of seminars in New York a few months ago, and they were very adamant about it then, and now it's really coming down all the way from the carrier. The FCC, as well as a new alignment program that they've got, really is just making sure that they are protecting the consumers. Where it really becomes an issue is if you're not abiding by do not call list, if you're not abiding by information such as that. So you do have to make sure that you are staying on top of those rules, and you are not calling cell phones unless you have written consent. Now, written consent is going to mean something that you have if you're purchasing leads or if you're buying leads from a vendor. You just need to make sure, because you are still ultimately responsible, that if that vendor does not have the appropriate TCPA laws written and exclusively written on the lead form, you are the one that's responsible. You can't say, oh, I didn't know it, I was buying it from a lead vendor. Not an excuse. The fines are upwards of $1,500 to $2,000 per phone call to a cell phone without expressed consent. Okay? And then if there's a policy written off of that, an illegal outbound phone call, there could be even more of a headache. So, talking $25,000 fine per phone call. So don't do it. Just be careful. We don't do it. We're very successful at what we do, so you don't have to do it either. I would advise everybody on this call and all of your agents that are working with you to make sure that you have the under 65 enrollment and open enrollment, the direct enrollment job aid completed, and go through that. There's a 40-page document here that you are going to want to go through that talks about how you set up APO, how how clients can log into My Blue Service and set up APO and make payments, make one-time payments, and things like that. So it would be good for you to diligently go through that. Okay. All right. Moving on, online payment option right here for qualified health benefit members. Those are something as well you're going to want to review. I wouldn't suggest printing it out because it's about 45 pages, but definitely go through that, and you should all be going through that on a regular basis. Another announcement that we had on the 7th of the month, so last week, we knew about this already, but we will be able to accept payments from CVS, and that is going to be available for our Affordable Care Act members for non-binder payments. Okay, so after December, once we get into our new world of insurance, so after January 1st, binder payment is made. Subsequent payments can be made at CVS. You cannot go do that now, but it is another way for our members to make payments. And really, the goal is all of our Affordable Care Act members, what they need to do is they need to be on APO. All right, because if you are taking applications that are not on APO, be prepared to have a headache and be prepared to have a billing issue, as we all experienced last year, and it is still a pain point for me, and I still get frustrated with it, because what we've got going on is that the 90-day chargeback rule and the 30-day chargeback rule for late payments. Remember, the same rules apply this year. For an off-marketplace plan, there is only a 30-day grace period. For an on-marketplace plan, there is a 90-day grace period. But that 90-day grace period is started upon the first late payment. Okay? So if they make 3 consecutive late payments, they will be terminated. And that will remain consistent for 2015. So how do we avoid that? We avoid that by making sure that they are on APO. Okay? All right? So we need to make sure that we've got everybody on APO so that way you don't have any headaches. All right? All right, so a couple of questions come in. I know it's not recommended, but I have a client who has a one-person group that ends on 11:30. Can I write a 12/1 effective date off exchange? Absolutely. You can write in. He has an SEP. It's not recommended because they would have to redo it, but because there's no subsidy redetermination for that, just be informed that you give him the 12/1 as well as the 1/1 price. Be mindful of closing plans or plans that are not going to be available. And also be mindful of the rate increase. Okay? Very important. Okay. Very important that everybody's comfortable with that. Now, I want to also talk to you that we do have a lot of new agents that have joined with us. I want to welcome you as well. Hopefully, you are on this call. I don't see a lot of new names on here today, so I anticipate that they're not on the call today. However, as you're going through this appointment process, it can be cumbersome. You're going to be getting 2 links from Florida Blue to fill out for your contracting. You have a background check, and then you have to upload your certificates. Ms. DeFalco has asked that once you get your writing number, you give her a call. And I would make sure that you stay on top of that. You stay on top of all of your sub-agents or your agents that are working with you to make sure that you're watching that process. That process can, if you don't keep your eye on the process, it's going to get away from you because you got so many other things that are happening. So you do need to make sure that you're staying on top of that. All right, let's talk a little bit about the renewal process. We were blessed with the presence of the president of Florida Blue. Mr. Rene Lier was here on Monday, so we got some time to spend with him and talk with him a little bit about some of the hurdles that we're all facing, and also discussed very strongly the renewal process. What everybody needs to understand is that the renewal process that we have this year, we really don't want to spend any time on it. And they are committed at Florida Blue to making sure that we do not have to do that. So what you need to understand is that you are going to be spending your time with new business. But those individuals that do not or that are already written, what you're going to want to do is you're going to want to send them to Florida Blue. Remember, if you get someone's client on the phone, let's just say you get Mrs. Jones on the phone. Mrs. Jones says, "Oh, I worked with that guy, Mark Carbellano. He's such a nice fella, but he's got an attitude. So can you be my agent and do my renewal?" You can absolutely do it, but that guy, Mark Carbellano, is going to continue to get his renewals. So guess what? Don't do it. Okay? Send them to Florida Blue. You want to be nice about it. You want to be gracious about it. And here's what you want to tell people. You want to tell people that the carrier is assisting us and working directly with the marketplace in order to facilitate the renewal process. I will still be your agent. I will still be here for you, okay, or whatever you want to call it. But call 1-800-876-2227. I would call that number in off-peak times. Off-peak times are going to be after 5 p.m. And when you call after 5 p.m., they are working Monday through Saturday, but that's how you will be able to get them renewed on their policy. Okay, you're not going to have time to do it. From a cost perspective, there's not enough money for you to do that process because you're going to be taking the same amount of time to do that process as you would be writing a new piece of business. So, blame the marketplace, which you can, but do not have them call the marketplace. Blame the government, which you can. And let them know that Blue Cross has a few hundred agents up in Jacksonville that will be able to assist in this renewal process. And you will still be their agent. And you should still give them a plan recommendation. And we're going to talk a little bit about that in a second. So don't spend your time on it. Get them to Florida Blue and make sure that those renewals are being processed correctly. If you are not busy right now, you've got nothing else to do, then knock yourself out and take care of it. If you've got a center of influence where that center of influence is going to be able to giving you 20, 30, 40 referrals, for example, then you may want to spend that time on that. But that is completely up to you. All right. So, making sure that you understand that renewal process, making sure that you understand that there's communications going out from Florida Blue. This communication that's coming out from Florida Blue is not an effort to get you away from the agent. It doesn't matter what anybody tells them, you are going to remain the AOR. So if any other agent does it, if the Blue Store does it, if anyone else do it, if they stay with Florida Blue, you are still the agent. Okay? So when you see that communication and they're inviting people to come and they're inviting people to learn more about Florida Blue and schedule your renewal and all that good stuff, just let them do it. We are sending out communications at our agency that is compounding the same thing that Blue Cross is stating, so we invite you to do the same. Please don't spend a lot of time on it. All right. Let's see. A couple questions coming in. Let me address some questions here. Jeff, you got to get me the name of that independent agent, please. When will the apply button be available? On the 15th. Best practices for renewing people last year, I just covered, Marcus, so that should answer that. Credit card fees, if they're using a credit card, who's absorbing that? Doesn't matter, not us. I'm coming across some businesses that are not offering coverage to the spouses but are contributing on the employee. Will the spouse be eligible for a subsidy? Well, that's really interesting. I've really not seen too much of that as far as them not offering coverage to spouses. But if they are truly not offering coverage to a spouse or family member, then they would qualify for a subsidy and they would qualify for a plan. So you can write them on or off marketplace depending on family income. Because the spouse is not offered coverage, you can write it. What are the hours for the number? The hours for that are 8:30 a.m. to 8 p.m. Monday through Friday, and then it is 8 a.m. till 6 p.m. on Saturday. And if I was a betting man, I would say that they will extend those hours for the renewal process following the first week. Do not have your clients call on the first 3 days. Tell them to wait. There is no reason for them to call and get aggravated on the 15th, the 16th, or the 17th, because those 3 days are going to be busy. All right. Prior policy canceled for a client because of residency documents were not received, even though they were faxed, mailed, and uploaded. Can I rewrite that policy in an open enrollment? You can rewrite that policy now, and you can rewrite it in open enrollment. Depending on the time frame of the cancellation, there will not be new commission to be paid, but there may be as well. It just depends on the time frame in which you write that application. If it's past the 60-day window, they should pay a new commission at that point. Where can I find an updated commission schedule? Your agency director, Marcus, would have that, and talk to OV. Does the AOR stay the same with off-marketplace plans? Yes, it doesn't matter on or off-marketplace plan. If I am an under 65 individual and I have a Blue Cross policy, your question is going to be, if you currently have Blue Cross, you can't write the policy and receive any commission. Now, if you are going to go through that process to write other business, to possibly get a group account, to do life insurance planning or something like that, you can do that. However, there will not be any commission on a policy that is currently with Blue Cross, even if that current client does not have an agent. Okay? So if they don't have an agent, they went to the marketplace alone, and there's no AOR, then there will remain no AOR. Florida Blue called me and offered to rewrite my policy at open enrollment. They told me that the AOR would change to Florida Blue if they rewrite the coverage. Is that correct, Billy? No, it is not correct. I don't know why they were talking about AOR. We had a conversation because that came up from another client of ours. I don't know why they're talking about AOR, but they cannot. Even if the AOR is removed on the marketplace. So if I go to the marketplace and I remove the AOR and I go in the navigator or whoever answers the phone over there, geez, sometimes, and they reprocess the application without the AOR, because as long as you're still with Blue Cross, excuse me, jeez. Even if they're still with Blue Cross, you will remain the AOR. Will Blue Cross guide them to new plans and discuss the benefits in detail? Yeah, of course they will. And we're going to talk about that in a minute after I get through these questions. Please send us copies of the letters and communications you are sending to renewal clients. Also, when we did Florida Blue renewal letters and communications going out by our clients. The communications, Kevin, that Blue Cross is sending out are right here in the bulletins. So you have access to all the communications that Blue Cross is sending out in the bulletins. All right? So if Gigi, you can ask Gigi about getting copies of our communications that we're sending out, but it's aligned with the same things that Blue Cross is. Okay? If you had a small group where incomes were typically in the subsidy range, could you structure the group plan to cover employee only so that the spouse and dependents would be subsidy eligible and avoid the family glitch? Not with Blue Cross. There's some pretty big group producers on the call today. Maybe they can shed a little light on that. But Blue Cross doesn't offer an employee-only coverage plan. Okay. If someone redetermines their subsidy on the marketplace and forgets to put your NPN number, will you remain the AOR? Holly, I think I answered that, and the answer is yes. Okay. Some of my clients have told me that they have not been notified of their premium increase. Well, that's odd. I got mine. I know that most everybody else has gotten theirs in their renewal package, unless they've changed their address or there's a different address on file. So that way we can. They should have gotten them already. So let's talk a little bit about the new plans. Couple questions, like Holly was asking, is how do we guide them through the new plans? How do we make sure that they're getting the correct information? And what are you really going to say to them or talk to them about? Well, we, as you know, you have a plan matrix, and a lot of us have been very confused with the new series of plans that are out there. And with those new series of plans, what you have to understand is that we have the 1410 plan, for example, which was designed specifically to get to the B and C variations. So what we've done as an organization is we've taken the plan summaries and matrices, we've made them in a very legible process that you can send to your clients. Now, with that, you can clearly see it's not as confusing as you may think it is. They handed out those nice big fat spiral books, and with those spiral books, it really looked like, oh my God, I have 70 different plans. I don't have any idea what I'm looking at. What am I going to offer? Well, there's really only three. Okay, there's only 3 B plans, there's only 3 C plans, then we've got our platinum plans, there's 2, you're only going to really sell 1. The gold plan, there's 1, and that's really going to be for all your platinum people that are looking to save some money. And then we need to be very conscious of the bronze plans this year, because the bronze plans this year are definitely going to fit more of a spot than they ever did before. Now, when they're going to fill a void, because on the bronze plans, when you're looking at them, you have a bronze plan that, has a little bit of a high deductible at $6,000, not the end of the world, but it has doctor visit copays for regular doctors and specialists. All other services are subject to our deductible. This is the way our everyday plan was last year. You've got an urgent care copay, you've got a convenient care copay, and you also have good coverage on your prescription drugs. But what you have to be conscious of is that with these plans, okay, when you're looking at a standard or lightly subsidized plan, you are really going to only have a couple of choices. Okay, so I want everybody to hear what I'm saying here. When we're talking about lightly subsidized plans and we look at the all plan matrix, you're really only going to be looking at a 1423, a 1423A, a 1431, a 1431A, or a bronze everyday plan. Let me repeat that again. A lightly subsidized plan is available, okay? We don't want to be selling, if someone is an A or B variation, a 1410 or a 14. These three plans here, remember the plans are all the same, okay? I'm referring to the blue options because that's how I always refer to it, and then you know that there's other plans that align with that. Gigi has in her Dropbox put a copy of the matrix that you're looking at here. That's in there. That is also located on IST, Karen. So if you don't have a copy of this, it's located in IST as well as your Dropbox. Now, when you're looking at these plans, you need to understand that you don't want to sell a 1443 or a 1477 or a 1410 basic because the plan has too much out of pocket. These plans were designed just to get to the B and C variation. So let's just say that you get somebody on the phone, and that somebody is a lightly subsidized individual. The federal poverty guidelines for 2014 are right in front of you on the screen, as you can see now, and there have been some slight changes. As you know, that if you've been looking at these kind of things, the new subsidy determination has gone from 11.4, and now we're at 11.6. Now, with that, you do need to be conscious of your A, B, and C variants on the plans. And with those A, B, and C variants, what I've done here on this chart is created a chart that will show you both breaking points as well as where the A, B, and C variants are located. So you need to be utilizing this and making sure that you have a copy of this on your desk so that way you can access it. Because if you're talking to someone, they tell you that they make $11,600. If they can find a little less money in their budget for 2014, 2015, if they can write off an extra $100, we can get them to a C plan variant. But when you're talking to people that are 200% of the federal poverty level and higher, you know that they are going to be lightly subsidized. And with that light subsidy, you are going to make sure you're concentrating on 1423, 1423A, these plans here, 1431, 1431A. As you see the plans here. And then additionally, no problem with going to our silver plan, our bronze plan on the Everyday Health, our 1416. So let me ask everybody a question here. On the Everyday Health plan, does everyone understand how the prescription drug coverage works? Because we have these little fives here. Does everybody following how this works? Do we know why there is a small 5 there? So nobody knows. I've only got 3 people that answered. We've got 43 people on the call. I'm a needy person. If I can have everybody answer just so I know where we're all at, I would appreciate it. All right, a lot of people saying no. Pretty surprised on that, but that means that is not covered until after the deductible. So what will happen is if I would not want to sell a 1416 plan to someone who is or has children on the policy, well, why is that? Well, because if I sold the 1416 plan to a customer who had small children and that child needed some sort of medication that is not treatment for a condition care program condition, I am going to have to satisfy my $6,000 deductible before I get my $10 copay for that generic medication. And if you are talking to someone who has children, that is not a good idea. Because if that child gets an earache and they need eardrops, and those eardrops are generic in nature, well, then you are going to have to satisfy your deductible before you get your $10 copay. Okay? So it's really important that you understand that. Does everyone know what the conditions are that are covered under the condition care program? Does everyone know what conditions are covered under the condition care program? Those of you that are not familiar with what I'm talking about, I'm getting a lot of no's. Very, very surprised with the no's. But with that, we have a chart, and we have some documents that are located in your Google, in your Dropbox. One of those is going to be the Condition Care Program fact sheet, showing that diabetes, asthma, depression, high blood pressure, and high cholesterol, and all of these conditions and medications are free if they are generic and they get them via mail order. If these medications are going to be a brand name medication, then they are going to be half price of the current or the standard copay. And that's why you see this 30 and 60 here. Because if I was taking a name brand medication, let's just say I'm taking Humulin, insulin, okay, brand name, then I am going to pay $30 for that. But if I'm taking a brand name drug that is not for a condition care, something for colitis, or something for Crohn's disease, then I would be paying a $60 copay. Okay? Does that make sense for everybody? Because I can see recipe for disaster here. All right? I will make sure that we have, Brett, Dropbox you should have already. I will make sure that all of these documents are in your Dropbox for you, and you will have access to them, okay? So very important that you understand how these plans are going to work. Making sure that we understand how the networks work. We also have a network comparison document that is available to you. And all of these documents and all of these things, I'm just haven't pulled them out of my behind and created them. Well, a couple of them I have actually, but not my behind. I've created them. They are in IST. They were in all of your Skillsoft training. They were in all of your training that you would have as well. Okay? So you do need to make sure that you're paying attention to those kind of things as well. When we talk about the products, we do have our all co-payment plan, which is going to be very exciting this year. And the beauty of that, you're going to be able to speak to your clients on almost all metal levels, but bronze, that we would have a zero deductible all co-pay plan available for them based on their income. Because we have all co-pay plans on standard plans, platinum and gold. We have all copay plans in silver on the B and C level. So you've got a lot of opportunity to talk to people about great products, and how we stack up in the market is very strong. Okay? So before I get to some of the competitive analysis and what's going to be out there in the marketplace, I want to touch on some questions, and I also want to make sure that everybody is familiar with MyPrime. We've covered MyPrime for Medicare. We've covered MyPrime for the Affordable Care Act. Is everybody or anyone have any questions about MyPrime and know how to search for drugs under the condition care programs? Okay, great. Everybody understands how to use MyPrime. We won't have any questions at all when it comes to it. So just make sure you continue without signing in. You are not doing a Part D member for the Affordable Care Act. Just briefly, find medicines. You're going to select what you are looking for. And let me ask a question. Can everybody answer, please? Which formulary list would I select here? Which formulary list would I select here? Okay. Getting some wrong answers as well. The answer is the VBD formulary list. So you'll select the VBD formulary list as your drug list of choice, and then you would type in your medication. Okay? So for example, if I was looking for Ambien, I can look up Ambien, put in my package size, and click submit. You need to be using the VBD formulary. Once my computer catches up to me, it's going to show that this is a not covered drug. But there is a button over on the right-hand side that says see similar medicines, and then they would give me any therapeutic alternatives that there would be. And you can see that we do have a few, quite a few, therapeutic alternatives that are covered. Okay, covered generic alternatives. I could switch to that medication, and I could see that that is on the drug list, and that is a generic medication. So, what would my cost of? Everybody understands how to identify the cost of that generic medication now, because it is not a condition care drug. So if I went back to my plan matrix and I was looking at my all copayment platinum plan, that is going to be a standard generic medication, and that medication would be in here. Okay? It is going to be a $10 copay. If it was a name brand medication, it would be a $30 copay. All right. So hopefully everybody understands that. We've covered it a multitude of times, so that one last time does not hurt. Under the inpatient hospital facility and rehab on the spiral book matrix, can you explain option 1 and option 2? Well, it's here as well. Option 1 and option 2 is all like that. That's based on the hospital and the hospital listing. They remain pretty consistent with all of our marketplace plans. Some hospitals are listed as an option 1 in the provider directory, and they would have a higher copay or a higher out-of-pocket expenses. With our marketplace plans, there is no difference. It used to be a difference before. In 2015, plans have embedded deductibles versus family aggregate. Florida told me there were a few, haven't had a chance to find it. We could take that off of our conversation, Kevin, because I'm not really too clear as far as what you're asking me as far as family deductibles or embedded deductibles. Family deductibles are going to be for HSA style plans. Those are going to be the off marketplace or the bronze. Otherwise, they are individual deductibles with family aggregates. So if we want to expand on that off of our call, we can do that. So lots of really good things going on. We have got a great product selection. I want to answer some of the questions that have come up while I've been talking. What are you recommending to sell to the B's and the C's? Well, my recommendation for selling to the B's and C's is not really going to make too much of a difference because the recommendations on the B's or the C's is really going to be driven by cost. So if you're looking at all of the B plans that I have listed here there's only 3 of them. So if you're a B variant, it's really up to the client. It's a cost perspective because none of them are bad. I mean, these are all amazing programs, but the cost basis is going to be what's going to drive their decision making. Both as a variable for network as well as benefit structure. Because as you can imagine, the plan all the way on the right, the 14, 31, 56, and 90 is going to be less expensive than the 10, 43, or 77. And that's going to be based upon cost. Okay? Martin, I don't know what documents you want me to email. I'm not emailing the documents out. They will be located in Dropbox. So I don't know exactly which ones you're talking about. Brett, access to Dropbox needs to be gotten from and Lonnie. Access to Dropbox, you need to contact Gigi on that so she can get you set up. She says you have access. Which plan for no subsidies? No subsidies are going to be 1423, 1431, 1416 based upon affordability. Those individuals that are going to be selling 1416, be conscious that you don't want to utilize that for children if you could avoid it, and be conscious of how the drugs are treated. Where can we get the CBA to understand? I don't know if I understand your question, Tina. So you'd want to get with Giggy so you can understand the A, B's, and C's. We have our subsidy chart if you're referring to that. This will be in your Dropbox so that way you can utilize that. So I don't know if you mean how do you understand the A, B, or C's. It's a vague question. If you'd like to type in a little bit more detail, I can get to it. All right. See some other questions that have come up. Can I explain Healthy Kids? I can do some broad strokes on Healthy Kids, but not really too much. Basically, let me pull that back up as I needed that. So what happens is that when you're looking at the subsidy eligibility chart and the federal poverty guidelines that you have in front of you right now, anybody that has children that has a family income of under 138% of the federal poverty level will go to Florida Healthy Kids program, but that's actually Medicaid for that. Ages 1 through 5, they will be forced to go to MediKids. Any family that has children with an income under 218% of the federal poverty level will be asked to go to Florida Healthy Kids. And none of those children will be subsidy eligible under that income range. 218% or less, if the kids are on the plan, they're not going to be on the plan. They're going to be asked to go to one of the state or government programs, and you're not going to be able to sell them a policy unless you do a standalone child-only policy with no subsidy. All right? Healthy Kids is a phenomenal program with great access to care for individuals. A lot of people say that they don't like Florida Healthy Kids. That's just because they don't understand it. The snapshot that you see on the screen in front of you gives you an idea of some of the benefits as well as the cost for Florida Healthy Kids. There is no problem with Florida Healthy Kids. It's a great program, but remember, under the Affordable Care Act, you can't double dip. If there is governmental money out there from a different agency, such as Medicare or Medicaid, you cannot choose to get a subsidy and get a qualified health plan rather than going through the appropriate process. You can't pick and choose where your money comes from if you are going to get some. Kevin, you're asking for the Dropbox link. You'll get that from Mr. Falco. Martin, another question about commissions that needs to go to your upline. Are they going to be continuing to pay a conversion commission for existing plans? No. The answer is no. Where do we find the plan matrix? I've answered that already. Perfect. Good. All right. So let's talk a little bit about the competition that's out there. Any other questions? Let me just see if anything came through. Still concerned with pediatric dental. I have families that will not be able to purchase additional dental. Could they have an issue with a subsidy? I have no idea, Justin. I don't understand what you mean you're concerned with pediatric dental. So you had clients that bought your plans, never bought a P plan, and you're worried about them losing their coverage. I wouldn't worry about it too much. Martin, you're saying you don't have access to Dropbox. You just need to email Giggy, and she can get it for you, okay? How do I understand A, B, and C? All right, A, B, and C is based on income. As you look at the chart in front of you, if you have a income level or range for the family between 100 and 150% of the federal poverty level, they will have access to a C plan variant as well as a subsidy. If they are between 151 and 200% of the federal poverty level, they will have access to a B variant on the policy as well as a subsidy. If they are between 201 and 250%, they will receive an A plan and subsidy, and anything over 250% of the federal poverty level, they will have a standard plan and just a subsidy. that is it in a nutshell. And if you need further explanation on the A, B, and C's, we have some videos from past trainings that you can access and maybe get a little bit better understanding about that. All right. Let's talk a little bit about the competition, and I would want everybody to be real excited. One last thing, we will just make sure that everybody is comfortable with the network comparison sheet. You should have this as well. There is also a county by county listing if you're doing multi-county sales, but you and your agents do need to understand the Blue Options, Blue Care, and Blue Select network in detail. It's a great document to have at your fingertips. So as we go back, I want to kind of go to healthcare.gov and make sure that everybody understands that we do have window shopping that is available. So if we go to get our coverage and we want to look at some plans, we can do that. See plans and pricing. Put in some basic information here. So for example, if I wanted to look at Hillsborough, I can take a look at what we've got out there. Put in some income levels. For example, if I was, 57,800 as a single person, put in my age, 35-year-old guy. Done with this step. Tells me estimates based on the subsidy. Looks good. Also, because of this, they are going to have a cost share reduction. That's going to be an A, B, or C variant. So if I come back to my chart and I was talking to a single guy who's making $15,000 a year, I know he's going to be right around here. I know he's going to be in a C plan. Then when I go to continue to plans, what this is going to do is give me some estimates. I repeat, estimates. Okay? Because these prices are off. I've checked with Florida Blue and CMS over the last couple of days, and I can tell you clearly they're off by anywhere between $10 and $20 per member, so that could be a lot if you have a family of 4. Now, this is sorted by monthly premium, but of course, because this is a C variant, let me ask a question to everybody. Because this is a C variant plan, would this customer be better off buying a platinum program or buying a silver program? This is a C variant plan, highly subsidized. Would they be better off buying a platinum program or a silver program? Perfect. Many of you are getting the answer correctly. Thank you. It is silver. So we know that they are going to be silver, and the reason why is because they are going to have a great solution, low out-of-pocket expenses, highly subsidized, and they are going to get a better plan. Now, take a look, everybody. I'm sorted by monthly premium. Who's the first company that comes up? Florida Blue. I'll tell you right now, these benefits are wrong. They've already identified that those benefits are wrong. They are completely wrong. So you would want to utilize your plan matrix in order to talk about the benefits themselves. But as you can see, sorted by monthly premium, we've got our PPO or EPO with Blue Select, a non-gatekeeper program. Then the next plan that we're looking at, and this is a zero deductible plan. This plan, they've got a deductible. They may have a little bit less out of pocket, but Humana is going to be running through a gatekeeper program. Okay? When we look at United Healthcare, these are going to have a higher premium, higher deductible, lower out of pocket. But when you're dealing with a highly subsidized individual, the out of pocket expenses are not as much of a concern as the deductible and the benefits that are within. And if they are going to have no charge after the deductible, we're going to win on that situation. When we look through, we go back to Blue Select, and we look at the competition that's out there, we are in good shape. Okay, feeling really good about what's going to be out there and what we're going to be able to access. Because those of you that sold on the marketplace last year, you can see clearly here the difference of $68 to $80. That's a big difference. Yeah, they have a zero deductible, but they can go back up to our Blue Select plan up on the top with a zero deductible and have a better selection and a better opportunity. So when you look at what the competition is doing out there, we're sitting really pretty. I know a lot of people were really concerned about competition in the marketplace, but after really starting to go through and delve into the price costs on our subsidized plans, we are going to be a very strong solution. Now, there are going to be a lot of pain points, not to be fooled. A lot of pain points for low subsidy plans or no subsidy plans, just because the cost of those programs with all the carriers are ridiculous. Okay? But you should get in here. You should use this as some estimates so you can be talking to your customers. This is a great opportunity for you to start talking to people and really setting things up and taking it to the next level so you're ready to rock and roll. All right. Covered a lot of things today. Does anybody have any questions? Excellent. Well, it is all going to start on Saturday, so I hope everybody is prepared. I hope everybody's got a few hundred people that you are ready to enroll, you should have your pipeline completely full. I would be prepared for headaches on the day on opening day. Okay, just be prepared for them. If you're prepared for headaches and everything works wonderfully, well, you'll be in a good mood. If you're prepared for everything to work smoothly and it doesn't, well, you're going to be in a bad mood. No reason to have a bad mood on a Saturday morning, so please make sure you just be comfortable to know that there's going to be some hurdles. Get up early on that day, get into IST, make sure that you're comfortable with the direct link and utilization of the direct link. I can't have a video or instructions about how to use it until it actually works. So once it works, then I will have a video out there for you guys to understand. If any of you or your team members are not able to access the direct link on Saturday morning, you're going to have to let us know so we can help you with an enrollment mechanism. All right? So we'll get with us, communicate with us, so that way we can work with you on the best way for you to use that process. Unfortunately, we won't know until Saturday. All right. So, no questions from everyone? Anyone who needs Dropbox, please email Ms. DeFalco. That is giggy@abifg.com. You should have her email already. Or any of these other supporting documents that you need, please make sure. My office is open on Saturday, but I will not be taking calls, so you can email me if you have any questions, or email Ms. DeFalco. Okay, and I don't know if she's going to be working on Saturday in that capacity, but my guess is she probably will be. But, Martin, get your questions answered before Saturday. You should have all of this stuff done now. Should all be a refresher. So anybody who has any questions, this should not be a big surprise that this was happening. Everybody's got a calendar, except for Blue Cross sometimes. So we'll be ready to go. And we are here to support you guys in any way that we can. Email communication, always the best way to get a hold of us if it's off hours, because unfortunately we're all workaholics. All right, everybody. I want to thank everybody for their time today. It's really exciting that we finally got the Affordable Care Act. Short window of opportunity to make a lot of money. And I haven't really touched on Medicare. I suppose that there are no Medicare questions because all of the people who are selling Medicare are out selling it right now instead of on this call. Okay. Very good. All right, everybody. I hope everybody has a great day. Enjoy, and let us know if we can help in any way, shape, or form.